You know, as the years go by, we get to know our bodies pretty well, don't we? We notice little aches. Maybe our eyesight changes a bit. Things aren't quite like they were. And our skin, well, that certainly tells a story of the life we've lived, doesn't it? You might see sunspots appear, or little bumps you don't remember having before. Most of the time. These are just part of aging. Harmless little reminders of sunny days, or simply the passage of time. But what if one of those spots, one of those changes, was trying to tell you something more? Something important. Something that could be a silent signal you shouldn't ignore. It can be worrying. Seeing something new or different on your skin and wondering, what is that little seed of doubt? The thought that maybe, just maybe, it's something serious. Skin changes can be incredibly common as we age, so it's easy to dismiss something as just another age spot or mole. But tragically, sometimes, that's exactly when a silent threat can go unnoticed. It's a painful reality that something so visible, something you can see every day, could be a sign of cancer hiding in plain sight. The secret isn't that you can diagnose yourself, but that you can become aware of the signs that scream, "Get this checked out." In this video, we're going to look at the specific changes you might see on your skin that could be those silent cancer signs, why paying attention matters so much, and what steps you absolutely must take if you spot something concerning. It's about empowering you with knowledge, not scaring you. And please, watch to the end, because there's something I'll share that might truly surprise you about how simple it can be to protect yourself. Let's start by talking about something many of us have plenty of moles. Most moles are completely harmless, little brown or black spots that have been with us for years, or maybe new ones that popped up in our younger days. They're usually symmetrical, have smooth edges, and are all one color. Think of a nice, round little button. But sometimes, a mole can start to change. And these changes are often the earliest warning signs of melanoma, which is a less common but often more serious type of skin cancer. You might have heard of the ABCDE rule before, and while it sounds a bit medical, it's actually a very simple way to remember what to look for when you examine your moles. Let's break it down gently. A stands for asymmetry. Imagine drawing a line through the middle of your mole. If one half doesn't match the other half, it's asymmetrical. Harmless moles are usually symmetrical, like a perfect circle or oval. If your mole looks lopsided, like two different shapes joined together, that's something to pay attention to. It's like looking at a reflection that isn't quite right. B is for border. Look closely at the edges of the mole. Are they smooth and even, like a clean line, or are they irregular, jagged, notched, or blurred? A mole with uneven or ragged edges is a warning sign. It's like looking at a coastline that's been eaten away in places, not a smooth, consistent shore. These irregular borders suggest the cells aren't growing in a controlled, uniform way. C is for color. Most harmless moles are a single shade of brown or black, but a mole that has different colors within it, shades of brown, black, sometimes even red, white, or blue, is a concern. Think of it like a patchwork quilt rather than a solid piece of fabric. The presence of multiple or changing colors in a mole is a significant indicator that something might be wrong. It doesn't have to be dramatic stripes. Even subtle variations within the mole are worth noting. D is for diameter. This rule used to say that any mole larger than a pencil eraser about 6 millimeters was suspicious. While larger size can be a factor, especially if a mole is growing larger, the emphasis has shifted a bit. Any mole, regardless of size, that shows other ABC signs should be checked. However, if you notice a mole getting bigger, especially growing past that 6 millimeter mark, it's definitely a sign that warrants attention. It's about the change in size or a generally larger size compared to your other moles. And finally, E is for evolving. This is perhaps one of the most important signs. Is the mole changing over time? Has it changed in size, shape, color, or height? Is it starting to itch, bleed, or crust over any change in an existing mole, or the appearance of a new, suspicious-looking mole, is a red flag. Skin cancer often doesn't look the same as it did last month or last year. It's the evolution, the transformation. That is a key indicator. You might not notice the change day to day, but comparing photos or simply remembering how it used to look can be helpful. This is why getting to know your skin is so crucial. You're the best person to spot a change. Think of it like noticing a crack in a wall that wasn't there before. It might start small, but if it grows or changes, you know something structural could be happening. So, when you're looking at your moles, maybe after a shower or when you're getting dressed, think of ABCDE, asymmetry, border, color, diameter, and evolving. Don't panic if you see one of these signs. It doesn't automatically mean it's cancer. Many harmless moles can have one or even two of these features. But if you notice a mole that ticks several of these boxes, or one that is definitely changing, it's time to take the next step. The most important thing is not to ignore it or hope it goes away. Early detection makes a world of difference with skin cancer. So, if a mole looks suspicious using this little guide, make a note of it. Maybe even take a picture to track it, and plan to show it to your doctor. It's better to be safe than sorry. Always. Now. While changes in existing moles are crucial to watch for, sometimes you might see something entirely new pop up on your skin. It might not look like a typical mole at all. And these new growths can also be a sign of skin cancer. Often the more common types like basal cell carcinoma or squamous cell carcinoma. These are sometimes called non-melanoma skin cancers, and while they are less likely to spread than melanoma, they still need to be treated because they can grow and damage surrounding tissues. These often show up on areas of the body that get a lot of sun exposure over the years. Your face, ears, neck, hands, and arms are common places, but they can appear anywhere. Let's talk about basal cell carcinoma first. This is the most common type of skin cancer. How does it often appear? Well, it can look like a pearly or waxy bump. Imagine a tiny, translucent or slightly shiny bump, sometimes with visible blood vessels threading through it. It might resemble a small mole or even a pimple that just doesn't go away. Another way it can look is like a flat, flesh-colored or brown scar-like lesion. It might feel firm or slightly indented. It's often painless, which is why it can be easy to ignore. Someone might just think, "Oh, that's just a little bump," or "that looks like an old scar," and pay it no mind. But if you have a bump that looks like this, especially if it's new or changing slowly, it's worth getting looked at. These bumps tend to grow slowly, but they don't disappear on their own. They can sometimes bleed easily, perhaps if you scratch them or even just gently rub them. Then there's squamous cell carcinoma, the second most common type. This one can look different again. It often appears as a firm, red nodule. Think of a red, raised spot that might be tender or painful to the touch. It can also look like a flat lesion with a scaly, crusted surface. This scaly patch might feel rough or bumpy, and it might even bleed or crust over from time to time. Sometimes, it can look a bit like a persistent wart or a sore that doesn't heal properly. These tend to grow a bit faster than basal cell carcinomas. Again, they commonly appear on sun-exposed skin, but keep an eye out everywhere. If you have a red, scaly patch or a firm, raised bump that doesn't go away, gets bigger, or starts to bleed, it's definitely time to get it checked. What's really important to understand about both basal cell and squamous cell carcinomas is that they often look quite innocent at first. They might just seem like a stubborn, rough patch, a little red bump, or a shiny spot, because they don't usually fit the typical mole look. People might not think of them as potential skin cancer, but any new growth on your skin that doesn't go away, or any existing spot that starts to change its appearance, size, or texture, is a sign that needs professional evaluation. Don't try to self-diagnose by looking at pictures online. You need a doctor, particularly a dermatologist, to properly examine it. They have the training and the tools, like a dermatoscope, which is like a special magnifying glass, to get a much better look than you can with the naked eye. Another key thing to watch for, regardless of how a spot looks initially, is any sore or spot that doesn't heal. A cut or a scratch usually heals within a couple of weeks, right? But if you have a spot that bleeds easily, perhaps when you wash or shave, and then scabs over but never completely heals, or keeps reopening, that can be a significant warning sign. This non-healing characteristic is common in both basal cell and squamous cell carcinomas. It's like your body is trying to fix something, but the abnormal cells prevent it from completing the healing process. So, if you've had a spot on your skin for several weeks or months that just won't heal properly, or keeps bleeding without much provocation, please don't put off seeing your doctor about it. It might seem minor, but it's one of those silent signals that shouldn't be ignored. Being proactive is truly your best defense when it comes to these types of skin cancers. So, we've talked about watching out for changes in your existing moles, using that helpful ABCDE guide, and also being aware of new growths that might appear, whether they look like pearly bumps, scaly patches, or red nodules. And we've emphasized that crucial sign of a spot that just won't heal properly. What does this all boil down to? It means getting to know your skin, really looking at it. It's not about being obsessive or worrying constantly, but about being aware. Think of it as just another part of your regular health routine, like getting your eyes checked or having a dental appointment. Taking a few minutes each month to look at your skin from head to toe can make all the difference in the world. How do you do a thorough skin check? Find a well-lit room and stand in front of a full-length mirror. Use a hand mirror to look at hard-to-see places, like your back, the backs of your legs, and your scalp. Don't forget your soles of your feet, between your toes, under your fingernails, and even areas not typically exposed to the sun, like your buttocks and genitals. As skin cancers can appear anywhere, look for anything new, a new mole, a new bump, a new patch. Look for anything changing, an existing mole that looks different, a spot that's getting bigger, changing color, or itching. Look for anything unusual, a sore that won't heal, a patch that feels rough or scaly, a bump that bleeds easily. It might feel a bit awkward at first, but the more you do it, the more familiar you'll become with what's normal for your skin, and the easier it will be to spot something that isn't. And if you do spot something that looks concerning based on what we've discussed today, a mole with uneven edges or multiple colors, a new pearly bump, a scaly patch, or a spot that just won't heal, what's the next? And most important, step it's to see a doctor. Don't delay. Don't wait to see if it gets better on its own. Make an appointment with your GP and show them your concern. If they also think it looks suspicious, they'll likely refer you to a dermatologist, a skin specialist, who can examine it more closely and, if necessary, perform a biopsy. A biopsy is a simple procedure where they remove a small sample of the skin spot or the entire spot itself and send it to a lab to be examined under a microscope. This is the only way to definitively know if it's skin cancer. It might sound a bit daunting, but it's usually quick and done with local anesthetic, meaning the area is numbed so you don't feel pain. The beautiful thing is that when skin cancer, especially basal cell and squamous cell carcinomas and even melanoma, is caught early, it is highly treatable. Often, it can be completely removed with surgery, and that might be all the treatment you need. That's why being vigilant and knowing what to look for is so incredibly powerful. It truly can save your life or prevent more extensive treatment down the road. Many people think skin cancer is just something that happens if you spend hours baking in the sun, while sun exposure is the biggest risk factor, especially sunburns. Skin cancer can happen to anyone, regardless of skin color or sun exposure habits, genetics, having a lot of moles, or a weakened immune system can also play a role. So, even if you've been careful in the sun, it's still important to check your skin regularly. And if you haven't been careful in the past, well, today is a new day to start being proactive. Protecting your skin from the sun going forward is also important. Using sunscreen, wearing protective clothing, and seeking shade, especially during the hottest parts of the day. So, we've covered the telltale signs to watch for changes in moles following the ABCDE guide. The appearance of new growths like pearly bumps or scaly patches, and critically, any spot that doesn't heal. Remember, seeing one of these signs doesn't mean you have cancer, but it does mean you need to get it checked out by a doctor. That simple step is your best defense. Please don't let fear or procrastination stop you from doing this. Your health and peace of mind are worth it. It's far better to have a doctor tell you it's nothing to worry about than to ignore something that turns out to be serious. Think of it as an investment in your future health and happiness. And that surprise I mentioned earlier, it's simply how incredibly high the cure rates are for skin cancer when it's detected and treated early. For many early-stage skin cancers, the cure rate is over 95%. Isn't that amazing? That's why paying attention to your skin isn't about dwelling on potential illness. It's about embracing the power of early detection and giving yourself the very best chance of staying healthy and enjoying many more years. I truly hope this information has been helpful and empowering for you. Taking care of yourself in all aspects is so important as we navigate these golden years. And skin health is a big part of that. Have you ever noticed a skin change that worried you? Or perhaps you have a story about getting something checked out. Sharing your experiences can help others. So please feel free to leave a comment below. It helps build a supportive community here. And if you found this video useful, please give it a like. It helps more people see it. And don't forget to subscribe to my channel for more tips and information on living your best, healthiest life at every age. Remember, small steps, like regularly checking your skin, can make a big difference to your health and happiness. Live your best life at every age.